this. I'm going to turn my computer on here that's got the questions that I started with. So I have to try to remind myself that what we're doing here is really intended for other people to watch. So I'll try to act like I'm directing this to other people and still at the same time talk to you. So what we're doing here today is we're taking some time to visit with Dr. Paul Coffin. And he is a podiatrist that we've worked with for, I know I've worked with you, Paul, for almost 20 years.
Yes.
This May will be 19 years that I've been at the clinic, and you were already here working with Ron long before that. But just to introduce people to you a little bit further, tell us that one of the questions that I had for you is what led you into becoming a podiatrist?
Actually, my uncle was a podiatrist in New York. All right.
Yep.
He also taught at the podiatry school, and I knew he taught biomechanics and orthopedics, but I wasn't sure I wanted to do that. So I taught school for 1 year, and that was my 6th summer going back to work in the orthotics lab before I taught school. My uncle picked me up at the airport, and he said, where are you going to graduate school? And I said, I'm not. I'm going to teach chemistry and physics. And I cannot repeat what he said, but the gist of it was, you will be in school somewhere next year.
That's funny. I don't know if I knew that you were talking about, ever thought you were going to teach chemistry or physics.
Well, when I was in college, I thought about being a podiatrist, but I just really wasn't sure that that's what I wanted to do. And I had my double major in biology and chemistry. The situation with it was, I just thought, well, do I really want to 4 more years of school and then a residency after that, another, 6, 7, 8 years of practice, or before I'm in practice. And so I just thought I would try teaching. I enjoyed the teaching for that year, but really what caused that with my uncle was my roommate and I had sent our grades in because we could send them in for free to the podiatry school in Chicago and New York. And my aunt told me a couple of years later that the reason he was so mad at me was because he had our grades. He didn't have applications to come to school, and he didn't have, our admission stuff or anything. So, but our grades were there, and he knew where we were. I was Coffin, Kurt was Hoig, and he was Schuster. I put the grades on the table when 2 spots came open in the middle of May before I got there. And he put them on the table, and the people on the acceptance committee said, we'll take these 2 if they're willing to come.
Oh, wow.
They had no idea. They had no idea what the relationship was. So,
yeah.
But the situation with it was I got there, a couple of weeks later and said, no, we were both going to teach school. So, but I said I would apply to podiatry school the following year, after I got into teaching, if he would stay out of it. If I got in, I wanted to get in on my own. And I belonged. And he said, well, that sounds reasonable. And so.
Absolutely. That's great.
These were my second parents. I had no idea how famous he was or anything. So, but he actually was listed in the top 25 things that happened to runners the first 25 years that published Runner's World. Number 4 was Dr. Sheen, who was a cardiologist in New York, goes to see Dr. Schuster for his first pair of orthotics for plantar fasciitis, and that was my uncle. And Sheen was the vice president of the New York Roadrunners Club. So my uncle just kept seeing more and more patients. And that was what Runner's World thought was the 4th most important thing that happened to runners in the first 25 years they published the medication. But we were making orthotics not always with non-compressible flexible materials, made it with a leather cover, with cork leather and latex underneath them. And that's how we would finish them. But that's what really made him work well, which is basically the same thing we do, but we're using more modern materials now. So
very good.
Answer the question?
Yeah, that's fantastic. I've been around you enough that part of me sits here and thinks I don't know how much I'll learn, but I've already learned more just here in the last couple of minutes than I expected to learn this whole hour. So, and then like we alluded to earlier, I know you've been working with Ron for a number of years.
Yes.
Tell us a little bit about how you got introduced to Ron, and what was your practice like before you worked with Ron, and how has it changed since then? I should probably clarify for people. I assume people know I'm talking about Ron Hruska, right. But Ron Hruska, who started the Postural Restoration Institute, and of course the Hruska Clinic, where I'm at.
Well, Ron had called up to the office, and I can't remember whether it was Mary or Paula answered the phone. Was it you? They talked to him first and said,
You called Ron.
"Did you call Ron?"
Yeah.
So, but anyway, the situation with it is the first thing he said to me was, "I really don't like my patients in foot orthotics." That was not a good start. But then what he said was, "But this is my third distance runner that's come back with your orthotics, and we've had nothing but problems with these guys for 5 or 6 months. And within 2 or 3 weeks of getting your orthotics, we've made incredible progress." He said, "I want to know what you're doing different." And I basically got started with saying, well, when the subtalar joint pronates, the knee is going to internally rotate, so they have to externally rotate at the femoral acetabular joint. And I was ready to start a second sentence, and he said, "We need to get together and talk." And at that point, I had no knowledge of postural restoration and an anterior tilted pelvis, which is really part of our situation with PRI. And our first discussion was about that. And so, but I knew that if I straightened somebody's foot and made it go, and it lined up the hinge at the big toe joint in the knee, that I could actually get them to run without getting shin splints, without having all kinds of problems. And they usually would run better and more comfortably. So I didn't realize that if we internally rotated, we had to do that, we would internally rotate the femoral acetabular joint. And then what would happen then is the pelvis would tilt back. And I just had no idea that that's what was happening with it. So.
Yeah. And I know for years you and Ron have talked back and forth on your thoughts on a number of things. And
Yes.
and it's so funny. You each have a little bit of a different philosophy of what's the driver and what's the I guess you could say the recipient. But yeah, I know Ron has always spoken so highly of you, and he knows that so much of what we do, we wouldn't be as effective without you.
And I've always told him I'm right. but I, this has been such a blessing to me to actually have learned a little bit more about the postural restoration. I know the first 2 times I came down to lectures, I think it was 2005 and 2006, and I really listened. And what was interesting, when Ron would be talking and everybody else would take turns talking, and then he would go back and sit in his little, library, I guess we would call it, or study. Yeah. And I'd go back and I'd say, "I don't get this one. What's going on here? Can you fill this in for me?" And then he would just explain it a little differently. And he would explain it from the point of view of the feet up and not necessarily the hips down.
Right.
And then at times he would ask me to explain some of my lectures from feet up, because there were things in there that he just wasn't quite thinking about. So.
Yeah.
Anyway.
Well, and I remember some of those talks that you did when you came, and I mean, and you do. There's always so much to learn, and having someone like you that's got the knowledge that you have and the experience, and you yourself as a runner, I know that's going to, I think, have a different impact than somebody in your field that never has been a runner.
Well, yeah, that's true.
I know we've talked before about how you'd get done going for a run, and while you were working with your with your uncle, and he was trying to figure out why you were making adjustments to your own orthotics.
That's correct. Yes, that's right. Well, it was adjustments that I was doing, putting on and gluing the stuff on, and then he would grind them down. And by into my second summer, I was getting reasonably good at grinding on the grinding wheels, but my job was really filling the casts, with plaster, and most of them were plaster casts, and then making sure the rough edges got off and smoothing them off so we could press everything onto them. We were pressing leather on them, and actually we were wrapping around with rubber bands around the leather to make it fit. And then the situation with the cork and latex stuff was we would actually then press that into the cork and latex. The cast, sometimes we did the cast, and we'd have to grind out the middle of them for putting the leather in. But it was just a little different way of doing things. But a lot of what we did with runners was putting wedges in the forefoot and wedges in the back based on the measurements. And I know you've seen my list of measurements, but those were basically very small alterations from what my uncle had on his sheets. And so I added a few things, especially for runners, that he didn't really do. But he was always interested in me. Can I tell my favorite story about my uncle?
Absolutely.
All right. So there was a a part that on a machine that we were using that had a little bit of a bearing in it, and it cracked and it wouldn't stay in the machine. And so I looked at it, and it's going to take 6 weeks to get the new part. And I drilled 2 small holes and threaded them and put screws in them and put it back together. And I was supposed to be doing something else. And about the 4th or 5th time, my uncle came back and said, "You really need to get back to what you're supposed to be doing." He was a little upset with me. And I reached over, flipped the switch on, and walked away from him. And he yelled at me, "You're the damn luckiest kid I've ever met."
That's
And he
funny.
was probably right. I've been blessed in my life. I've been lucky. So
Well, you know, Paul, I've worked with you enough to know that you have got such an intuitive sense of how things work, and not just the human body and the biomechanics of the feet, but the equipment. I almost wish everybody could see the equipment that you've got in your workshop and how much of that you've customized to your own purposes. And
that's all.
and you've got equipment that literally nobody else in the world has, because it's been your design and your creation, along with some other people that I know you said you've been blessed to know that can help you along the way. I mean, we've talked about how you just the motor that you have in one of your grinders. What is that? It's a 5 horsepower motor, which I don't think most people would really appreciate how powerful that is.
No. Well, that particular grinder, we got to pull the drive shaft and get a new one made, because we're getting a little more vibration, and we need new bearings in it, and we definitely need fan belts in, but we don't want to take the time to do it because they'll be behind with making orthotics.
Right. Let's see. One of the other questions that I had asked was, have you always just made orthotics, or were there other components, other things that you, with your patient care, have done in your practice?
Well, I had a surgical residency at the Washington, D.C. VA. And by the time I was done with podiatry school, though, our senior year, we got to do a lot of outpatient surgeries with other podiatrists who really would like some help in their operating room. And so we would go help do them. And if they were doing bilateral bunionectomies, most of them would do the first one, teach you as they were doing it. And then the second bunion, then they'd say, "Nope, you're here.
Wow.
You make the incision, you do the surgery. But if you make a mistake, I'm taking the instruments away from you."
Wow.
And so if you did them, I don't ever remember the instruments being taken away from me. So,
well, that's good.
That was the bone cutting and putting the screws in and everything else. So, but I don't know, about the time Ron was talking to me, started talking to me, we had 4 or 5 new podiatrists in Sioux City, and I wasn't as excited about surgery anymore.
Yeah.
And we were doing more and more biomechanics in the office. And so that was really part of it. And part of it came down to, as we had more physical therapists sending us impressions, then I needed to have less time in the office. And so we're really down to 1 day a week now. And the rest of the time I'm spending making orthotics for other people, which I probably was born to do that anyway. So,
yeah. Do you know what, like when you first started working with Ron, about how many orthotics per week or per month were you making, and where is that at now?
Well, we were probably, I would say, in the office, we were usually, when we were having 2 and 3 days a week, or a week in the office, every day we were probably getting somewhere around 5 to 7 impressions. So probably 15 to 20 impressions a week.
Yeah.
About 80 a month. And so, I did some, with that question, I actually did something, I don't know. But I went back and I looked at the records for the last year, and we were averaging between 40 and 60 pairs of orthotics a month, depending on the month. And the situation with it, I think I thought about, it was about 2,000 last year that we made.
Wow.
And about 100 were mine. I don't remember. I didn't do my own. So
yeah,
we still do a fair amount.
Yeah. So yeah, good. We still do a lot. Yeah.
Yeah. And are most of those now from other therapists that are practicing PRI?
I think we have 1 or 2 that I'm not sure are practicing PRI that we had before we started working with PRI, but the majority of them are for PRI patients. So
yeah, amazing. Let's see. I think we've covered a lot of those questions. Let's see. One of the questions I had too was, and I feel like I'm jumping around a little bit with the questions I'd put together, but when you first started working with Ron, what was your expectation? Would you have envisioned a couple of thousand orthotics a year?
Just to get people better.
The first time I came to a meeting, right, and he asked me to talk, I said, this is going to change my life. I don't know if I'm going to be able to handle this or not. And that was about the time Jeff was looking for a job, and his brother was a guy I ran with all the time.
Yep.
I said, I got to find somebody to work in the basement with me. And he said, oh, Jeff's looking for a job. And Jeff spent his first week. He doesn't drive.
Yep.
He was a 3-4 student at Briarcliff with a double major in English and chemistry, if I remember right. And then the situation with it was I go pick him up and bring him out to the house. But the very first week we did that, we would drive home the first 5 days, and all the way home, he would be saying to himself, I don't get it. I don't understand this. I don't understand what we're doing here. I'm confused. And took him home on Friday night, and he looks over at me as he's getting out of the car. He said, yep, it all makes sense now.
Wow.
And he mixes all the chemicals for us. He because of his chemistry background, and then does all the vacuum pressing for us. So
yeah, he does a great job. I mean, I sit here and think it would be a challenge for you if you didn't have Jeff right now.
Yeah. And then Paula's brother, Philip, he was working in the oil fields down in Louisiana and Oklahoma, and his wife was having some medical problems. So he came home, and Paula said he's looking for a job. So I think she twisted my arm. So Philip could come. Not a little.
He's worked up well.
Yeah, he's been very good. But
he does. They both. I've had opportunities, and I'm looking forward to more opportunities to come and work with you. But they both of them, Philip and Jeff, they just know what they're doing. They just do their job.
Well, Philip had a lot of experience with machining and with the movement of materials through bandsaws without cutting your fingers off. And he didn't have much experience with the grinding wheel, so we started him on the 4-inch one and smoothing out casts, and he's doing that extremely well.
Yeah.
There's just things that I really think I need to do with the 4-inch wheel and with the coarse materials for him before he sands them. But he's slowly catching on, and he'll sometimes come over and say, did you really want this bump on here? And sometimes the answer is yes, and sometimes no. But he's actually getting to the point now where he can take and level out the bottoms for me. Sometimes he gets too much off the medial side of the heel, and then we have to glue something back on. But the situation with it is he's getting better and better. He's learning to grind down to the black level, just so you can just barely see it through the cream color polyurethane, and then flatten it out from there to the big toe joint. So he's doing well.
Good.
So the finishing part, I think eventually Philip will be able to finish really well. It's just a matter of getting used to it. Jeff's real problem with the grinding wheel is he can't watch the orthotic and not watch the grinding wheel. But Philip's got that figured out already. So
yeah, good.
So those are the things that are happening there.
Well, you've got some great people that you work with. Of course, you talk about Jeff, you talk about Philip, you've got Paula, and then there's also Kathy and Peter.
She's going to ask me for a raise now.
That's all good. It's all good.
Yeah, it's all right. So,
but what role? So, Kathy, your wife, of course, all of us here at the clinic know her very well, and Peter. What roles do they fill these days?
Well, Kathy, because of her chemotherapy for her cancer, is really struggling keeping track of things. This person who was incredibly bright and really had everything in mind, that she's lost a little bit, won't you say?
A little bit, but she's doing remarkably well.
Yeah.
Well, I've noticed.
Yeah.
In the last year and a half, how much she's so much closer to being her old self.
Exactly.
Yeah, she is.
Exactly. She's enjoying life. She's doing things. She's a big part of everything.
And every day she says, when are we going on vacation again?
Yeah. I don't blame her.
So,
but I just wanted to say, it's really what Paul does. It's an art and it's a science.
It really is. Absolutely.
He's a craftsman,
Most definitely. Yeah.
We're also proud of him.
What's that?
We're also proud of him. We
Yeah.
just really appreciate everything he does for all the people that use his orthotics and that really support him and what he's able to do to get people back into their sports and into everyday active life. So you got that.
Well, I know we have patients that they would never reach the goals that they're after if it wasn't for Paul and the product that he puts together. And I know I've got a long ways to go, but I've been up with Paul probably 6 or 8 times and down in the workshop, and I know there's certainly some skills that I have to continue to develop, but I think with Paul's leadership, hopefully I can get to a point where to some degree I can take a lot of this on as well, for at least for the Hruska Clinic and maybe some others. Paul, how would you say PRI orthotics are different than other orthotics that you're familiar with?
Well, first of all, we're taking a impression, or hopefully everybody's taking the impression in a neutral position, right?
Yeah.
And we don't want weight bearing on it.
Right.
Some people are using the biofoam, they're actually weight bearing their patients on them and letting their foot just fall to where they go. But that's taking the impression in a pronated position. So what we do is we want to line up that subtalar joint. And then the situation with it is once we get to there, that's the beginning point. And because we still want people to pronate, we don't want them to pronate too much, and we still want them to supinate. And so if we can maintain that positioning and keep the knee and the forefoot going the same direction, which means we're lining up the first MTPJ and the knee, because when you land, we want it to pronate and lock the first MTPJ so they don't go over on their face, but then to push off when they move the opposite hip forward, it needs to be able to bend the big toe joint. And if they're externally rotated at the femoral acetabular joint, the foot's always abducted or pointed out. And if you just take a foot, dorsiflex it and pronate it, or by pushing up on the third, fourth, and fifth metatarsals, and then put a little pressure underneath the first med head, and ask people to bend their big toe, they can't do it.
Yeah.
And then put them back in a neutral position and roll them around back into a neutral subtalar and then a slightly pronated forefoot. That big toe will come right back up, and they get it right away. And if you have a callus underneath the IPJ and the hallux underneath the first metatarsal head, you know that they're walking with an out-toe gait. So, so what I'm doing is trying to keep them in that mid-range of motion, and then I want an orthotic that when they're walking in it, it will twist back and forth like the foot is supposed to, because when you come down, you want that mid-tarsal joint, metatarsal cuneiform joint, and the cuneiforms to actually loosen up, and we want that first metatarsal head to come up. And then when they go to push off, you want that as that heel's coming off the ground, we want that opposite hip taking and externally rotating the femoral acetabular joint and rotating it around the talus, the ankle joint around the talus, which is really what we really need to do when we're walking. And if you watch normal people walk, or if you go to the mall, you can see people walking down the mall with their feet and their knees going straight ahead, and they really aren't having any problems. That's a person I really don't need to see.
Right.
Somebody who's walking with their feet pointed out, 25 to 35 degrees. And I'd always noticed that something wasn't quite right at the pelvis area, but until I met Ron, I didn't realize how much it was tilting forward because the femoral acetabular joint was actually rotated to keep the axis of motion of the knee perpendicular. So in reality, if I summarize it, then the goal is to keep the axis of motion of the knee going straight ahead and keep the foot in a pronated, slightly pronated position when they land, and then help it supinate that foot, which is the springiness in it, to pop the subtalar joint back up into a neutral position, or help it go to a neutral position or back in a slightly supinated position to lock the mid-tarsal and Lisfranc joints in place, take the tension off the flexor lucis longus tendon so they can bend their toe and push straight. And once you got that, then as soon as you've got that femoral acetabular joint has to rotate forward, and then that's what helps pull it back. Now, the problem with it is if they've been in that position for a very long time, they need to do postural restoration, those muscles, and pull them back. But when we, one of our problems sometimes with Jane is I make I'll make an orthotic for somebody, and then I'll say, okay, I want you to come back in 2 to 4 weeks, and then they're already feeling much better, and then they don't get back in. So
Right. Yep.
And so the situation with it is that has been a problem sometimes with our physical therapists, wanting them to work immediately, but it really comes down to the brain and the motor cortex and what's the other one? The sensory cortex. All right. And the sensory cortex, for anything we do, creates an engram, which then tells us to do. And the easiest way to get that across to patients is if you ask them, are they right-handed or left? And they say, I'm right-handed. You say, when you're writing with your right hand, do you think about it, or is it just right? And they say, well, it's just right. So I don't have to think about it. I just have to think about it. Well, what happens with your left hand? Well, I really have to think about it. And they say, well, why can't you write with your left hand? Same muscle, same tendons and everything. And that's where I get them to start thinking, okay, I got to retrain or actually produce a new engram in my sensory cortex for when I'm walking straight ahead. And that doesn't happen overnight. It takes a couple of weeks of walking in the orthotics. One of the big problems I see, am I overdoing this now?
No, you're doing fantastic. So many things. I'm loving all of it. Retraining. That's what we're about here at the clinic,
Right.
and
that's exactly what you're doing. It's
exactly.
You're changing the muscle recruitment patterns. And so
yes,
the first time Ron started talking about that, I was sitting there and said, oh, yeah, this really makes good sense. I can see why that really helps my patients get better. So
right. Well, one of the other key things you talk about is sense. The sensory input, and that's a huge part of what we do here at the clinic is, we'll have people, we want to know, what do you feel or what don't you feel with your feet on the floor? And without the flexibility that your orthotics have, if you have an orthotic that's acrylic or hard and you lose the normal foot mechanics, that's not a functional orthotic at that point.
Well, I'm kind of laughing because I learned how to make stainless steel orthotics.
Wow.
I was not a blacksmithing kind of a guy when I was 18 or 20 years old. I was 130 to 135 pounds and running 100 miles a week. But
wow.
But Willie Berger, who is my uncle's cousin, was teaching me how to do it. He finally got frustrated with me with every single one I was doing and would take it out of my hands and finish it. But he didn't. Hand shearing a piece of 18 to 20 gauge steel, and then heating it up in an oven until it was red hot, and then taking it out with a tongs and hand hammering it until you get it pretty close to the shape. And then
wow,
I learned to do that, and we did make a lot of those. We did make plastic orthotics at the orthotics when they became popular because a lot of podiatrists wanted them.
Uh-huh.
I never really. I think I made one pair of plastics, and they were made by a guy who knew what he was doing. And one run in them, and halfway through the run, I took them out and took them home and threw them in the garbage. But the key is that it doesn't matter what we do. I could put a thumbtack underneath somebody's forefoot, and every time they came down, if they hit the tip of that thumbtack, they're going to supinate their foot.
Yeah,
and that's going to change. If they do it long enough, it's going to change their muscular contraction problem by the sensory cortex changing the engram. But the situation with it is that's not really what we want to be doing with orthotics. What we want to be doing with orthotics is they should be able to put them on, and after a couple of days, not even notice them there. And
and I would say rarely do I ever have any patients that do anything other than that.
Yeah, and that's about right. The biggest problem with that is they put them on and they already feel better, and then they break them in slowly. But that has not really been a major. That's not been a major problem. So
very good. Well, Paul, we're getting close to wrapping some things up here. One of the questions I know gets asked a lot is, well, how much longer is Paul going to work?
Oh, we've never heard that before.
You don't want Kathy to answer.
I know Kathy's answer. Yes. And I often ask myself, I don't know what Paul would do if he wasn't making orthotics, because I know you love it. I know you love the time in your shop. It's who you are.
Yeah. I think my uncle was still making orthotics into his 80s.
Wow.
I would be surprised if the day before he had a heart attack that he didn't make a pair of orthotics, to be honest with you. But when he retired and somebody took over the lab in New York, They moved to Florida to be closer to their grandkids, and I think the grandkids lived 2 or 3 houses away, and they were all pretty young yet. And then he worked part-time in a podiatry office down there, but every time I was down there, he was still in his garage, and he had a small grinder instead of the big ones that we had in New York, but he was still making a few orthotics for people. And
wow.
so, but he just always enjoyed that. And times when I would be down there, he'd say, "Can you help me with this one?" But, so, and then he and Aunt Grace came to Sioux City after I got my first big grinder made, and he said, "Oh, that one looks perfect." So
nice.
So these were my second parents. I mean, he was adamant I was going to go to school. But
that's great. Well, Paul, I appreciate your time, and I do personally appreciate you so much. You've done so much to help me along the way, learning the process, and I look forward to being back up there with you again. And we will wrap things up here. Thank you.
Yep. Thanks. Talk to you later.
Yep. I'm gonna